Hey guys, Adam Thomas, Osteopath Central, here for the Sports and Spinal Rehab series here on video coming live. Today's a little bit of a fun one. I find it fun. It's drugs. Drugs and pain, drugs and back pain. This is part of the acute back pain series. This is for the people who have done something in the last 2 weeks and they've come to see the osteopath. Now, talking about drugs in our scope of practice as osteopaths, legally we're not allowed to prescribe drugs. In fact, our commentary on drugs is often via the GP or via the pharmacist as a result of the scope of practice that osteopaths are allowed to have in Australia currently. And when we talk about drug use, we're talking about legal, over-the-counter things that you could just go to Woolworths or Coles and buy, or the pharmacy. Now, the problem with these drugs, and the brand names of them, Voltaren, Advil, Nurofen, the list goes on. They're all brand names of things like diclofenac and ibuprofen and the likes, even aspirin to some extent. These anti-inflammatory or non-steroidal anti-inflammatory drugs are just as harmful and just as bad as the ones you get on prescription, the Mobics and the like. Okay, so in fact there is some data I think that says that the prescription drug of Mobic from your GP is somewhat safer now than the stuff you can get from Woolworths. These things aren't lollies, guys. Don't pop them. Don't spend all day, every day on them. When you're in pain, it's important to know when to use them, how often to use them. It's written on the packet to the maximum dosages, and going over that or having them on empty stomachs and things like that can cause some serious gut problems and some serious consequence on your health and heart health and things down the track, particularly chronic long-term use of them. However, on a light note, drugs are awesome when you're in pain, and we're talking about that acute pain per presentation. First 2 weeks it's inflamed, it's been proven, you've had all your tests down there at the osteopathic clinic and the osteopath told you it's inflamed. You know, you've sprained a facet joint, you've done this, strained a muscle, you've got a tendonitis or a bursitis, or you've done something that has proven to have inflammation involved. If you're not a drug seeker or drug taker, some people revert to that. There are herbal remedies available through your naturopath. There are some creams available, things like Traumeel and Physio Cream. Often those things with their dosage rates aren't anywhere near as severe as the pharmaceutical grade things like the gel rubs that Nurofen, Voltaren, to stick with the brand names, produce. Now they're also skin rubs that go on, but what goes on goes in, and they are drugs, and you cannot combine them without appropriate advice. So you can't put the Voltaren gel on and take Voltaren without discussing that with your GP or pharmacist in detail, particularly if you're asthmatic or have heart conditions or kidney issues, okay? So appropriate drug use can be amazing, and it can be a massive assistance in your rehabilitation program. As an osteopath, we often tell people to go discuss with their GP the use of non-steroidal anti-inflammatories, the use of analgesics such as Panadol, branded as Panadol Osteo, is just a high dose, okay? So I just wanted to put this little video out there reminding you that they do have consequences. You can't chew them down like lollies. They do need to be under advice, even though you can buy them from Coles and Woolies. They do provide a really important step in your rehabilitation program, but they have to be done under guidance. And done under guidance, they can be really awesome short term and really, really bad taken wrong, or for the long term, or inappropriately for the wrong person. So as osteopaths, we work closely with your GP. If you have any questions, let us know. We can write you a nice big detailed list of a letter, so you can print it out or take the email, and you take it to your doctor and say, look, I've had all these tests done, these guys are awesome down there, and they've done all the safety tests the neurosurgeons would do and the orthopedic surgeons would do, and they've diagnosed me with this. What can I do to assist the recovery? And that's where you can get a safe usage of the drugs. So that's it for me for drugs. Drugs are